Health and Wellbeing Board meeting of the 24th of June. This is a live team meeting. It is being held in public, so welcome to those who have dialed in or are viewing it on the internet. We have done a check of those members of the Health and Wellbeing Board who are present, and I'm not going to go through asking everybody to introduce themselves. They will become live when there are questions or if they are giving part of the presentation. But to assure members of the public that at the moment we have members, my name is Rebecca Knox, I chair the board, Forbes Watson, who's the vice chairman, Alan Clevitt, Sam Crowe, Julie Fielding, Spencer Flower, Tim Goodson, Margaret Guy, Kate Harvey, James Jackson, Laura Miller, Seth Y. So others might join us, but we have a very good complement of members of the board today. The first item on the agenda is apologies. There have been a few apologies, but where there have been apologies, we have their named substitutes in attendance. Helen, you will record that the numbers today, won't you?
Yes, Chairman, yes.
Thank you, Helen. Has anyone got any declarations of interest? No. Oh, I'm sorry, for those who weren't on the earlier call, please, if you do have a question to raise, use the hand function, raise your hand, but also that we are using chat. So if you have a question there and I'm not spotting the hand coming up, please type in the chat, and between the two mechanisms, I hope that everybody will be heard when they wish to speak, or make a comment only in the chat. That also will be recorded. Rebecca Kirk is with us, thank you. That's great to see you on as well, attending for Vivian Broadhurst. Right, I now move to the minutes of the last meeting, which was held on the 27th of November. Has anyone got anything to raise under those minutes, which is a matter of accuracy? If I see nothing in the chat show or no hand sign, the next few seconds or so to give you time, then I will take it that there is no matter for accuracy. Teresa Levy has just called us, welcome. And is there anything coming out of the minutes which any member would like to raise as a follow-on from any action? Again, raise hand or type in the chat box if you would like to raise anything. And in the absence of anything being seen in the next seconds or so, then I shall take those as agreed. We now have another member join us, Karen. Welcome to represent John Selgren, the Director of Place. Nothing is coming up on the raise your hand or the chat, so I shall take it that those minutes can be signed. Thank you, members. Public participation. I don't think we have had a submission of a question or statement for public participation. Is that right, Helen?
That's correct, Chairman.
And so I'll now move on to the next item on the agenda, which is one of the main items today, which is the local outbreak management plan. For those of you who, again, are not introducing this, please switch off your cameras. And I'm going to hand over to Matt Prosser, the Chief Executive of Dorset Council, and Sam Crowe, the Director for Public Health for Dorset. So, Matt.
Chair, thank you very much. And can I start by offering my sincere thanks to all who've been involved in developing this local outbreak management plan at pace. In the circumstances that we've been working, it's been an incredibly good piece of partnership working. As is set out in the reasons for the recommendation, key to the success of this plan, should we ever need to enact it, will be our communications with our residents, our communities and businesses through the member-led public engagement board, a really, really important part. Sam will perhaps go into a little bit more of the detail, but key to the success of this plan will be ensuring that we socialise the contents in advance of need, ensuring that if we are moving at pace with an outbreak in either a setting or a business or a community, there is a broad understanding of what we will do and when and how. Elected members overseeing and guiding this engagement work is vital, linking to the widest network of councillors and town and parish councillors, community, faith and voluntary groups if needed, as well as obviously our schools and local businesses. There's been much talk in the press of local lockdowns, and I hope we're never in a position of needing powers to deliver the plan. And in fact, I think that actually we would feel that perhaps we've not done the right thing if we've got to that point. But obviously we need to be prepared for that should that ever need arise. So communication is really clear to me. It's the most important thing, and actually having that local member engagement board and using the health and wellbeing board as part of that as set out is really, really important. Chair, can I pass over to Sam, our Shared Director of Public Health, to take you through the narrative in more detail. Thanks, Sam.
Thanks, Matt.
Thank you very much, Matt. Thank you very much, Chair. Good afternoon, members of the board. So I was just going to perhaps start by setting a little bit of context around the local outbreak management plans. Those of you who've been following some of the system briefings that the public health teams provided over the past few weeks will have realised that we're now in a pattern of very, very low numbers of cases in Dorset and indeed in BCP Council. And that's important because we're now moving into what's known as the contain strategy nationally, which is our phase of living alongside COVID-19 as we start to open up, come out of lockdown and move into recovery. And so I'm really pleased that councils have been given a huge opportunity to lead that work. And this has been described as now integrating our local expertise and our local action and our local knowledge with what's been stood up regionally and nationally, particularly in the first phase of the pandemic. So all upper tier councils have to have an outbreak plan published by the end of June, and funding has been provided nationally to support the development of those plans. That amounts to around 1.28 million for Dorset Council, and that funding is to support any identified gaps in capacity and for us to think about using creatively to try to make sure that we can continue to support any of the actions we might need to take in response to an outbreak with a really effective set of interventions. So it's been described as outbreak plans are really our first line of defence now against perhaps a second peak occurring and the situation where we might need to move back into a national lockdown situation. Matt referred in his introduction to this concept of local lockdown, and I agree. Let's hope that we never need to invoke particular powers in that situation. So in that context, I'd like to stress that a lot of what's in the plan builds on work that's already been underway for the past 3 or 4 months as we've been working through the pandemic. Lots of the business as usual work around outbreak management and response has been going on between the public health team, teams in adults and children's services, CCG colleagues, particularly from the quality team, infection prevention and control officers have all rallied around and provided a fantastic response to when we've had outbreaks in particular settings like care homes. The other point I was just going to share was that we're moving through the first gateway with this plan. So after this meeting, we'll share with you the draft narrative framework. It's around 30 pages long, and it's only an initial setting out of the thinking across the 7 themes that are required by these plans. What's really important is how we bring the plan to life. And so I was just going to spend a few moments highlighting some of the next steps and progress with how we make this plan a real live working effort. So the narrative frameworks are intended to be published in the public domain via both health and wellbeing boards. We've had meetings now with the regional convener, Jill Stewart, who's providing a light touch assurance around the plans. Jill's looked at both the Dorset Council plan and the BCP Council plan and given them a broad seal of approval with some very, very helpful feedback as to how we can improve them. But just for the board's clarity, this is really just setting out the initial thinking and requirements across those 7 themes. What we really need to do as the next step is to bring it to life by publishing the plan, probably as an online toolkit. There will be more and more resources coming out from the centre in the form of action cards and strategies from the Joint Biosecurity Centre, which feed into our local outbreak management plan and support some of the responses that we would take under different situations and different scenarios. And the most important next step is really thinking through what our local thresholds and triggers might be. So I've explained how much of the plan captures our business as usual response to outbreaks, but should we be in a situation where we're seeing an upturn in community cases or patterns of transmission that are a cause for concern, what we need to be really clear about is what are the thresholds where we might start to move out from our business as usual response, which could be the type of work that we do alongside single agencies, into something that might more clearly resemble a requirement for a community to behave differently. So we might be saying to a particular community, actually, it's really important that you don't go to work, you don't go outside as much, you do try to stay indoors, and perhaps you go back to more strict social distancing measures. But just how we do that, it's really important that we have those discussions as a system and with our partners to understand that we're being really, really clear when and if we need to stand up that response. Matt's highlighted the importance of comms. I fully support that. I think this is all about working with people and communities. If we're asking people to behave differently in different situations, or to perhaps take on board public health actions or more stringent actions because of particular local outbreaks, it's important that we do that so the public has a full understanding of what we're asking them to do and the reasons why we're asking them to do that. And part of that work will be workshopping and exercising the main high-risk scenarios with key players from not just councils, but across the wider system. So the plan sets out those settings that we consider to be the highest risk in Dorset and with the highest likelihood of seeing infections and outbreaks. Much of the work has already been done, so we've got a good understanding now of the support that's going in to the care home setting. We've done lots and lots of work with schools and early years settings, being very, very clear about the type of support that's on offer from Public Health England. But it's still important that we play through what might happen in particular scenarios so that those plans survive that sort of really pragmatic testing. And we've thought through from different angles what might be some of the issues we need to take on board. The fourth piece of work will be agreeing an agreed resourcing and capacity plan. And again, we'd like to link that with this theme of risk. So we would prefer that the resources are used against the highest risk settings and the settings that are most likely to be in play in terms of how our plan focuses. And the final piece of work will be more work on integrating the national data flows and particularly working out, what we would add as local interpretation, if you like, to what that data is telling us. So we're getting better and better data, but one of my concerns is how we are transparent with the public, but at the same time balance the need for transparency with an understanding of how important it is not to alarm people overly. And there's some information governance and security issues about perhaps how we share that data and in what format and in what forum. So the ask today of the Dorset Health and Wellbeing Board is in relation to one of the more interesting aspects of this idea behind local outbreak management plans. The day-to-day business, if you like, of outbreak management will be done by a joint COVID health protection board, which will run across both councils. We've had an existing health protection network, which has been in operation for a number of years. It's been well staffed and well resourced. We've got good representation from environmental health officers, infection prevention and control specialists and public health people on that board. We would like to agree terms of reference for that to become our main COVID-19 health protection board and to do the day-to-day work of outbreak management and working through developing this plan further. Overseeing that board in each council, we're proposing that we would use each health and wellbeing board to be these new COVID-19 local outbreak engagement boards. So the plans are quite interesting in that the idea at the centre of them is that you have this triangle of relationships between leader of the council, chief executive of the council, and director of public health, with the leader of council or chair of health and wellbeing board offering political leadership to do that public facing steer with communities about what we know about COVID in our local area, and being very clear when we need to explain some of the additional actions that people might take, what is required of people, and being very clear about the rationale. Chief Executive is responsible for how we allocate the resources that have been given to support the plans, and the Director of Public Health is responsible for overseeing the work of the Health Protection Board and making sure that we've got a really effective public health response. So the recommendation in the paper today for members of the Health and Wellbeing Board is just to consider the proposal that we would very much like the Dorset Health and Wellbeing Board to function as our public engagement board for COVID-19. It may be that we would stand up a subgroup of that board at short notice, and we provided some guidance in the paper as to suggestions for the minimum membership that might be expected to be called on. As we're all teleconferencing with Gusto, it shouldn't be too difficult to get the chair of the Health and Wellbeing Board, leader, chief exec, director of public health, relevant corporate directors, if required, to come together and consider any urgent issues that we might need to take via that public engagement board. So I'm happy to pause there. I'd strongly urge the board to support that recommendation and also to endorse the draft framework narrative, which will follow on from this meeting this afternoon. Happy to pause there and take questions, Chair.
Thank you very much, Sam. That was really good run through. There is a paper which is in the public domain, but I know you've got a huge amount that falls underneath the outline, but the outline is really clear. I'm going to ask Councillor Laura Miller, because of course this is her cabinet role area. So Laura, over to you.
Thank you, Chair. Yeah, I just wanted to echo Sam's recommendation really, and to support it. I think this is absolutely the right vehicle to do that engagement, to do that work. I think it's absolutely right that local authorities and local public health is involved and manages this area, which is something that was, very much pushed for and very much the right thing to do. So really, I don't have anything further to add to Sam's brilliant introduction, except to say thank you for the hard work that's gone into this, and to recommend that we do go with this recommendation. Thank you, Chair.
Thank you, Laura. So there's a proposer of the recommendation, and at the moment I've got hands up from Forbes Watson. Forbes.
Okay, good afternoon. Thank you very much. Just to say that I'm happy to support the proposal as presented. Sam, can I just ask a question? On the paper, it talks about the assessment of risk. Can I ask, you've got current risk high and residual risk high. Who is responsible for making that assessment? What's the frequency by which you review that assessment, given the evolving situation? And with whom does that responsibility sit?
Thanks, Forbes. So I think there's probably two different things going on here. This is the risk assessment in the frontis for the report on the Health and Wellbeing Board. And I think the way that the report author was thinking about this is, what is the risk of not supporting this recommendation in this paper? Right. Obviously, the risk to our community is a very real, live and evolving situation, which will be reflected on a regular basis through the sorts of surveillance information that we continue to return to the system. So for the board's assurance, we had a very good strategic coordinating group meeting earlier today where we discussed both of the plans, and we're starting to think through which of the elements of the local resilience forum response we retain as we sort of step back into recovery mode. Cells like the EpiCell, which we stood up to provide routine surveillance information and modelling information about the impact of the pandemic, that will continue. That will be at the heart of supporting both of those outbreak management plans. We will continue to be assessing the risk to our communities on a regular basis and providing regular briefings through the structures, and many of the LRF cells will remain, including the warning and informing cell and the multi-agency information cell. So there's a slight difference really in the risk in not supporting the paper is high, because we obviously need to do this. If we don't have a good plan and a good framework and we don't have a public engagement board, then we're not going to pass that first gateway test. But the current risk to our communities, as we say in the system briefings, is currently fairly low. We've got low numbers of cases. Obviously, if that changes, we will be briefing several times a week as to what we think the current assessment is. Is that helpful? It is. It's a helpful explanation. Thank you, because it seems different to what we were seeing on the ground at this point in time. Thank you.
And is that it, Forbes? Any follow-up?
No, I'm done. Thank you.
Okay. Then Councillor Spencer Flower, leader for Dorset Council.
Thank you very much, Chairman. I'd like to associate myself with positive comments that have been made about this report. I'm amazed at what pace has been used to get such a comprehensive document in front of us today. I think the decision in that sense is relatively straightforward. I shall certainly be very, very supportive of it. The fact that we've got a multi-agency approach to this issue is comprehensive. I could say lots of really positive things about this. And Sam and all of yourself and all the other officers have pulled this together. Really good piece of work. So thank you very much.
Thank you, Spencer, and I'm sure everyone would really like to see this implemented. And of course, there is a priority for this. As Sam said, we can't not have one, and there is some resource. And let's hope there's resource that will follow on from all of the detail of the plan that Sam and you and the Chief Executive will be pulling together further. I haven't had any comments in the chat room, and I don't see any other hands up. We have a proposer and a seconder, so I'm going to suggest that we're all in favour, and I will give you some seconds. Maybe I'll say, is there anyone who is against? Please raise your hand or type. No. Is there anyone who'd like to abstain? Again, I'm not seeing any indication, so I'm going to take it that all members, and we now just have about every single member of the Health and Wellbeing Board on this meeting, agree. And thank you, Sam, and what a huge amount of work has been done and will have to be done in the future, but much appreciated. Right, great. We'll now move on to the next item on the agenda, which is the Dorset Care Home Plan. Again, a lot of work, I know, has been put into this. Alan, might you take your video off? And this time we are going to have again the Chief Executive Matt Prosser to introduce the paper, and then Tony Meadows will be taking us through the rest of the report. So over to you, Matt.
Thank you again, Chair. If I could, as I say, just give a few words of introduction, and then Tony Meadows is on hand to help with detailed issues. As members of the board will have read, Helen Whatley, the Minister of State for Care, on the 14th of May asked for local authority chief executives who have responsibility for social care to be responsible for the planning return, supported by the Director of Adult Services, the Director of Public Health, and also our clinical commissioning group. One of the huge benefits, I have to say, of COVID-19, if there has been the accelerating and deepening of system relationships. And I'd like to thank again our shared Director of Public Health, Sam Crowe, and his team, Director of Adult Services, Vivian Broadhurst, and Tony Meadows in particular, and team, and also our clinical commissioning group, Tim Goodson and his team, for their support and input to this care home plan. Again, developed at pace, in challenging circumstances, but dealing with some really important issues. And perhaps if I can turn now to page 27, 27 of the report. my letter to the Minister that sets out the response. And this was prepared in line with the guidance and using the template and involving all of the partners that the Department for Health recommends. So that is that letter that sets out a short overview of the current activity and forward plan, a template that confirms the current level of access to support to the support offer, and finally a confirmation that local authorities are carrying out a daily review of the local care market, which we are doing, and taking actions immediately where necessary to support them. And I have to say, Chair, whenever there have been questions around what the team has been doing and how it's been supporting, they have not been found wanting, and have put an incredible amount of effort into that. So my thanks to them. And I'll hand over to Tony, who'll give a little bit more detail into the care home plan.
Thank you. Hi, Tony. I'm not hearing anything at the moment.
Sorry.
Okay, you're on. Good.
Okay. I was just going to echo some of those points over the joint working on this piece of work. Ourselves, Bournemouth and Christchurch, and also the CCG have worked very, very extensively. One of the important bits was also the provider market, care homes themselves, who have actually worked with us and been part of actually co-producing a lot of these responses. And I would say that we have worked in a way that previously we would never have felt was possible. So from my point of view, I just want to recognise their involvement. So going back onto the actual paper itself, the requirement was basically to comment on almost a stock take that was being taken of how a number of initiatives had actually landed with care homes. Now, this was done through what is called the National Capacity Tracker, which is a web application. This has been established nationwide. It's basically to look at the actual capacity in care homes to actually take placements, etc. But it's also been revised to actually look at some of the day-to-day issues that are facing the homes, so they can report on particular items of PPE they may have problems with, staff shortages, etc. And this was updated for this piece of work to also consider the accessibility to PPE and supporting the training around that, the ability to safely isolate residents and protect from infection, managing the risk of cross-infection from staff across locations, etc. One of the things to bear in mind, this was a national piece of work that was put out. It was done at pace, and there was quite a lot of confusion from care homes because some of the answers were very, very binary, and that was reflected in some of the initial responses, but we'll talk through that as we go. This was, as we've said, done at pace. It was basically, we were required to complete and submit everything, including the analysis of all of the responses from care homes. So again, at a point of crisis, getting 124, 125 individual care homes to respond and basically to go through that was quite an achievement, but we did manage to do that. So that again, positive from that side. Also in the response, we had to detail the financial arrangements and support that we had put in place. So again, this is just confirmation of those actions. So, you know, we had taken the step and the decision to utilise COVID funding for a 10% temporary uplift to care home fees and all other contracted fees with the care sector. We were paying immediately upon receipt of invoice, no implementation of terms, etc. We have a process in place where if a provider has hit particularly difficult times, we will work with them to support reviewing those cost pressures. And again, the most important bit being the fact that in addition to the LRF provision, in terms of the PPE, we have also supplemented that with additional stock, which has been purchased by Dorset Council and provided to providers free of charge. And this is where the presentation seems to have gone. Am I still being heard?
I can hear you, Tony.
Okay. I'm getting a wheel of doom with the presentation, so if you bear with me, what I will do is just switch to my desktop so I can actually take you through verbally, if that's okay.
Yes, that'll be fine. Thank you.
Okay. So in terms of the responses received from the care homes, again, some of this is contained in our response, but just some significant highlights. The initial response was that, again, when we're looking at access to PPE and the correct PPE, which is also a significant issue, 84% of residential care homes actually responded that way. The definition of care homes in this isn't just for older people, it's also learning disability, etc. And one of the key considerations there is the availability of certain specialist PPE. So, for example, the use of clear face masks. And again, that is not available in the UK. So some of the responses will have been tempered from that. The ability for people to actually isolate residents within homes and reduce the movement of staff was at around 82%. And again, sometimes this is down to freedom of movement. And also the isolation element, where some of the older homes in the area maybe do not have ensuite facilities, etc. So again, for a care home to actually commit to saying, yes, we can definitely do that, sometimes they have to view it in terms of the risk within their location. Originally, they stated that obviously in terms of training and support in PPE, 86%. So again, quite good from that point of view, and training it on medical equipment, because care homes have been asked and required to use things outside of their normal practice. So things such as pulse oximeters, etc., which again they've worked towards and have received training, but that is again been dependent on need in some situations. 74% of residential care homes at the point that we actually took the snapshots were registered with the National Testing Portal. Just to give an indication on some of those, so we are obviously utilising this tool and this approach not just for this report. It gives us an opportunity to monitor the landing of any change in guidance or any support initiative that we put in, because care homes are being encouraged to update regarding some of the questions around things such as infection prevention and control, testing, PPE, etc. So within the slides, what I had hoped to show you was that, for example, if we look at the ability to isolate, the work that we've actually done with the sector has taken us from a 76% of homes saying that they can safely do that, up to now a figure of 89%. If we're going to look at access to PPE, that has now increased from 84% to 95%. So again, this is demonstrating that each of these actions and the responses that we've put in place to address some of this within our plan is actually moving the sector forward from that point of view. Alongside with the plan and the obviously the letter was the £600 million worth of infection control grant that was announced on the 14th of May. We received the conditions for those on the 22nd of May, and the conditions were quite restrictive. The local allocation had to be split, basically 75%, which was for care homes with very, very strict conditions on what they could actually spend it on. It had to be around infection control, but could not be utilised for the purchasing of PPE. We had to obviously distribute that, and we've also had to instigate a process for monitoring how that money is spent, because the conditions do state that that can be reclaimed. With the additional 25%, we had a little bit more freedom, and we worked with care providers to actually work up the solution to how we would utilise that to support the sector. And again, demonstrating how well the sector worked together, private care home providers worked with us and actually suggested that that money should be allocated to supported living situations, which aren't included in the care home listings, and to home care. So we have also now been releasing the funding in that direction as well. We are producing our return to government on how the first payment has been spent and the submissions we've received, which is due on Friday. And then basically over the course of this, by September the 30th, we will have to actually provide DHSC with a particular statement certifying that we've spent all the funding, otherwise it potentially could be reclaimed. To put it into context, we've actually paid care homes 116 grants totaling just over £1.7 million. We have had 6 homes decline. and that is where they feel that they cannot spend the money within the conditions. And again, that is in line with sort of national trends. And we've got a couple of care homes just outstanding where we're waiting for the information through. In terms of home care and supported living, there were 51 providers eligible for the funding. We've had 42 returned, and we've issued 314,000, or in excess of 314,000, and we're just waiting on the remainder of those. But again, to put that into a context again, within a very, very short period of time, not only have we had to report on what we would be planning to do, but we've had to administer and set up a whole infrastructure to manage the grant and to enable payments, not just to contracted providers, but to those in the private sector that only take private funded individuals as well. I think that takes me roughly to the end of the presentation. Apologies, you missed some of that, or has it appeared? Do we have any questions?
Thanks, Tony. Yes, and there is a question. Laura's got her hand up, and some of it did pop back up, and that was helpful.
Oh, good.
Would you be able to email that to members?
Yes, that's fine.
Okay, Laura.
Thank you, Chair. Yeah, really just very similar to my previous comment about the outbreak management plan. Just really to offer my thanks to Tony and his teams, because you can see from his introduction in detail that just quite how much work in such a short space of time has gone into this. And I think it's absolutely tribute to the fact that we have almost overnight, I think, achieved integration where we hadn't before. And I think that this is an excellent example of that. I would thoroughly endorse this recommendation and support it, and just really wanted to use my position as cabinet member really to jump in first and say thank you. So thank you.
Thank you.
Thanks, Laura. There are two hands up at the moment. So Margaret Guy was first, and then after that will be Tim Goodson.
Thank you. I'm Margaret Guy. I'm on the steering group of Healthwatch Dorset. Healthwatch Dorset has been undertaking some discussions with care home managers over the last couple of weeks. And there still seem to be some issues with testing. So some care homes where they haven't got the results back when they've had their staff and patients tested, or they've come back void and they've had to be repeated. And another issue is some issues still with residents returning from hospital and getting confirmation that they have been tested for COVID-19 prior to discharge back to the home. Otherwise, the other themes that were coming back from those discussions mirror really what you've already been saying. Thank you.
Thank you, Margaret. Just to come back on that, I mean, part of the joint working that is coming together, or has been pulled together over this, is that we are meeting twice a week with both public health colleagues, CCG, and representatives from providers, and we are actually highlighting those issues both as a system so that we can actually manage those solutions, but also we're feeding into both regional and national forums where those issues are wider problems. So just for reassurance that we are taking all of that in a very much live situation, because one of the things with the tracker and the constant communication we have with the sector now, which has really improved, we are getting that information live and we are able to act on it very, very quickly. But if you get anything like that, I'd be really, really grateful if you could feed anything back to me. That'd be really appreciated.
Thank you. I'll ask Louise Bake to feed back to you. Thank you.
Brilliant. Thank you.
Thanks, Margaret. Tim Goodson.
Hi, thanks. So Tim Goodson, the Chief Officer of the CCG. Just wanted to really sort of echo some of the comments that have been made there. And it is actually reported at the very last page, the report, page 40, that it was fully discussed with the CCG and other NHS colleagues. We sort of went through that, so we sort of fully endorse it and just recognise the huge amount of work that actually went into this during a very challenging time when guidance was coming out thick and fast, really, probably quicker than we could actually sort of go through and actually try to piece together the actual impact of what was being said. So I just think it's a really good piece of work and happy to support it.
Thanks very much, Tim. And now Forbes.
Yeah, thank you. Yeah, just wanted to say I thought it was a good piece of work and it's been very interesting. I've heard a lot about it, but to see it actually in one place has been very helpful. Also wanted to add, as a GP who practices in the west of the patch, I regularly meet with our care homes and have done so through COVID, and all of them have been very complimentary of the support that Dorset Council has given to them at this time. So I felt it only fair to pass that on. I think that's credit to all of you who have been involved in this. And my final point is just the learning from this and how we take it forward and establishing a new relationship with care homes as part of a better integrated health and care system. And I just wondered what your comments with regard to that would be.
Make sure I'm not on mute. I think, to be honest, the lessons learned, we've already, I think from my point of view, definitely from a commissioning point of view, I've taken them on board. The engagement and the way we're working with the sector has changed fundamentally. In terms of how we communicate with providers, we are actually working with the providers to jointly produce these things now. We were in conversations earlier where recognising that provider failure is quite a problem at the moment in terms of the care home market, especially with occupancy levels. And we've got a group of providers who have obviously got a little bit of self-interest, but actually want to work with us strategically to look at how we can sort of remodel what the future needs may be. So it's in their interest, obviously, but they are coming to the table and they're doing it really openly now. And I think there's that trust that's been developed because we were all together, shall we say, at that real crunch point of crisis. We're relating in a different way. And for me, that's been really rewarding. And I think for that is the biggest lesson in terms of how it isn't a them and us. This is a system and they share that with us. And they are an important and integral part of that. And I think that recognition enables us to change things.
Yeah, thank you. And that would be the same as my personal experience and practice, actually, and just that more regular contact, sharing the challenges that we collectively have has been very fruitful. Yeah. Thank you.
Thank you.
Thanks, both. And the next hand up is Spencer Flower.
Thank you very much, Chairman. I just want to voice my support for this piece of work. It's a key piece of work. But well done, Tony, and everyone else who's been involved in it. And I wanted to say it rather than just be silent when we agree it. I'm sure we will, because we need to take this forward in a really constructive way. So, yeah, well done. Thank you.
Thank you.
Thanks, Spencer. I haven't seen any more hands. There are a few comments in the chat, but I can't see any other questions at the moment. But again, I think Tony and the team, to reiterate, what a fantastic piece of work done at pace. And I know the data sharing now is not absolutely perfect, but you told me, I think the other day, that we're probably 2 years plus on in a matter of months, which is quite extraordinary. And what a fantastic new culture of working that is being developed here. And let's keep it up. Matt quite rightly has pointed out, this was a sort of for information, but actually because of the need to have signed it off between Health and Wellbeing Board meetings, it normally would have done here. So it would be good to get that formal agreement and congratulations, and we would look forward to hearing any updates in between, but also obviously the Health and Wellbeing Board will be following this closely, due to the relationship that has built between every member of the board and each of the different organisations we represent, particularly the voluntary sector. So it's lovely to see the commendation from Alan earlier. So I don't see anyone disagreeing. I can only see two faces at the moment, but I'm not seeing anything. So I'm going to say that let's actually formally agree this is a fantastic piece of work, move it forward, and look forward to next positive steps. So thank you, Tony, Matt, and everybody involved.
Thank you, Chair.
Thank you.
Chair.
Right, we are now moving towards the end of the business today. But the next item on the agenda is the forward plan. Now, moving at such speed as we are with the Health and Wellbeing Board, some items which would have been taken in normal circumstances and not necessarily on the forward plan. So we're going to try. We will put items back because health and well-being is a big solution to a lot of the prevention work that we want to carry forward. But I'm going to ask that items that people have and would like to raise now, maybe type them in the chat or raise your hand if you do have an item. I think it's pretty obvious that these two, particularly the first one, will be coming back at our next meeting. But in the meantime, we will also revisit that important prevention work, which will be linking up with ICS work as well. So in between, there'll be a lot of exchange of information and ideas. But if anyone has something that they would like to put on the forward plan now or suggest, please do so. Okay, not seeing any hands, but discuss either with me, Helen, Sam, Rachel Partridge. Right, Sam, would you like to speak? Sam, you've got something here. So I'm going to ask Sam just to raise what he said in the chat for the benefit of the public.
Thank you very much, Chair. I just thought it might be at some point, I know this is making a rod for our back perhaps, but it'd be good to relook at the health and wellbeing strategy that we were discussing before COVID, but perhaps through the lens of what we're learning in the post-COVID world and linking to the recovery work and the reset work and the transformation work, which is now starting to proceed apace. And I know that previously we'd had discussions about the joint strategic needs assessment work that was going on in support of different strands of the strategies that we wanted to emphasise, particularly the focus on physical activity, which I think the board was wholeheartedly supporting. It might be timely just to have an agenda item where we have a bit of an open discussion about where we think the priorities might lie, perhaps in the next 12 months or so, and perhaps get that work back on track.
Thanks, Sam, and absolutely a lot of lessons learned, and there'll be a different way forward, and physical activity is one of those areas we've shown the public embrace in many ways over the last months. There's a hand up from Julie Fielding. Julie.
Thank you, Chair. So I would appreciate a conversation about vulnerability and particularly vulnerable people in the community. So we've done a lot of work within COVID and in recovery around vulnerable people, and along with a refresh of the terms of reference, I'd welcome a wider conversation about how we are protecting and supporting people who are vulnerable in our communities going forward.
Thank you very much, Julie, and I think that takes forward a conversation that we had at a previous board meeting, where obviously the data that you have with the police and the data that fire has and the data that social care have and everybody's data, we were probably looking at a group of vulnerable people who we all come across.
Yes, that's right.
Yes, and I know that James was talking about that the other day. So yes, absolutely noted. Thank you for that. Laura.
Thank you, Chair. Just really to say that with reference to Julie's comment, I raised this with James a little while ago, in the last couple of days, because it's something that is ongoing and that I want to explore further. He was very keen to do so, so I think we're going to set something up to look at that. So Julie bringing it up is actually really timely. So yeah, let's look at that.
Thank you.
Thanks, Laura. That's really helpful, and we look forward to hearing with that. And I'll talk to you about when we might be able to report back to the board and have that other discussion to take it wider with partners. That'd be brilliant. I don't see any other indications either in chat or with a hand up. So I'm now going to move to the next item, which any urgent items. I haven't been notified of any urgent items, but I'm very happy to accept an urgent item from any member. No urgent items. I'm sure everything seems a bit urgent at the moment, but that's a relief. There is an exceptional urgent item. Then there is on the next item, number 9, is exempt business. Helen, just confirm there is no exempt business today.
No, there is none.
No, thank you, Helen. So I'll draw the meeting to a close. Thank you, Helen, and all of you who have been helping with the technology behind the scenes to allow this to happen. Really, really grateful. It means that we can have these meetings in these difficult times and make some really, really important decisions across all of our organisations across Dorset. So thank you very much to all of you. Stay safe and let's keep up the good work. Brilliant. Bye.
Thank you, Chair.
Right.